I rise in strong support of H.R. 485, my Protecting Healthcare for All Patients Act, which affirms every person's life has value by banning the use of quality-adjusted life years, or QALYs, and similar discriminatory measures from all federal healthcare programs. As many of you know, my son Cole was born with an extra 21st chromosome. Most of you know it as Down syndrome. When Cole was born, the doctors gave us a long list of challenges and chances for heartache. It was difficult, but I could have never imagined just how positively he would impact my life, my family's life, and the world. Today, Cole is a fun-loving 16-year-old with big dreams. He wants to be a football player, a pastor, and a race car driver. He's on the basketball team. He plays the drums. And for Cole, the sky's the limit. Cole and others with disabilities deserve every opportunity to succeed. We shouldn't be discounting their potential or prejudging the quality of their life just because of their disabilities. Unfortunately, several tools frequently used in our healthcare system do just that. QALYs and other similar discriminatory measures assign a dollar value on the life of a patient to decide if a certain treatment is cost-effective, oftentimes discounting an individual's worth and the need for care solely because of their disability or chronic illness. It means that bureaucracy coldly determines the value of someone's life and could deny necessary health care due to that calculation. Measurements like QALYs remove the consideration of unique circumstances and health conditions of a patient and their doctor's judgment from deciding what's best for the patient. I'm not alone in opposing the use of these measures. Democrats acknowledged this when they passed the Affordable Care Act and they banned the use of QALYs in Medicare. In 2020, the Democratic National Committee platform stated that, quote, Democrats will ensure that people with disabilities are never denied coverage based on the use of quality-adjusted life years, QALY indexes. The nonpartisan National Council on Disabilities wrote a report in 2019 titled Quality-Adjusted Life Years and the Devaluation of Life with a Disability that condemned the usage of QALYs and has continued to write additional letters to Congress urging us to ban their use. Additionally, we've heard from nearly 200 advocacy groups spanning the political spectrum who are calling on Congress to prohibit the use of QALYs and other discriminatory measures. This legislation, the Protecting Healthcare for All Patients Act, bans federal payers like Medicaid and VA healthcare from using QALYs or other discriminatory measures that devalue the lives of people with disabilities and chronic or rare diseases. And it does it by simply applying the current ban on QALYs and other similar measures that exist in Medicare today to all federal payers. In passing this bill, it will mean that healthcare bureaucracies can no longer discriminate against the weakest and most vulnerable patients, and it will help ensure that people can get the health care that they need and that their doctors think best. This would be a big deal. Medicaid is the largest payer for people with disabilities, and we are letting it use measures that discriminate against the very people it was designed to support. And that's nothing to say of the millions of injured or disabled veterans who rely on the VA for their health care, which is also allowed to use these types of measures. However, let me be clear in this. H.R. 485 does not prohibit healthcare programs from rewarding value or finding other ways to hold down cost. For example, if a treatment does not work or shouldn't be covered, or it's more appropriate to start with other more cost-effective treatments first, nothing in this bill will preclude federal payers from continuing to make these kinds of coverage decisions. In fact, the National Council on Disability has already identified alternative ways to measure value that do not devalue the life of someone with a disability or chronic illness. Because of Cole, I've spent much time in Congress as an ability advocate, encouraging people to focus on every individual's God-given talent and potential. Millions of Americans like Cole need their voices to be heard. Whenever I meet someone with a disability or chronic illness or with their family, I hear the same thing over and over. They want the same chances to succeed in life as everyone else. And you know what? We're all just one car accident or one diagnosis away from having a disability ourselves. I hope that banning the use of discriminatory measures by federal payers against people with disabilities and chronic illness and affirming every person's life has value is something that we can agree on. Let's give people with disabilities, rare diseases, or chronic diseases hope. I urge support on this important legislation, and I reserve the balance of my time.
The gentlelady.